The trauma activation request is used to initiate a trauma alert to the receiving trauma center. See your local protocols regarding the circumstances that require EMS to initiate a trauma activation to the receiving hospital. Here's how it works. First, click the icon. Then fill out the form. You'll notice that the form requires you to input all areas highlighted in red and are self-explanatory. Select your EMS unit number, which is customized to your EMS agency. Then input the patient age and gender. Next, indicate if signs of shock are present by selecting yes or no. Then select an ETA. And finally, enter the patient's Glasgow Coma Scale or GCS. Although not mandatory, EMS can include a brief description of the injury as well as additional notes in these areas, which may be beneficial to provide. Whatever you input, keep it simple. Once you've completed the form, hit attach in the upper right corner. You'll then be prompted to select the destination hospital that you're attempting to transport the patient. Select the hospital and hit send. Prior to sending, review the summary and add attachments if needed. Remember, the eBridge application allows EMS to send audio, video, or pictures to help the hospital best serve the EMS crew and the patient. Think about how nice it would be to immediately show the ED the vehicle from the motor vehicle crash, or instantly send a picture of a bad laceration or fracture that may need surgery. Again, a picture says 1,000 words, and EMS doesn't have time to talk that much. So why not just send a picture so you can get back to focusing on patient care? You get it. Once you've reviewed your summary, hit send and wait for a call from the receiving hospital via the eBridge application. The hospital will receive and review the notification form and any notes or attachments. Then the hospital will contact EMS via the eBridge application and take a report from EMS. Hospitals are aware of the serious nature of a traumatic injury like this, and they will contact EMS at their earliest availability. Once communication is established, give your trauma report to the hospital per your local protocols and keep it clear and concise.